Everyone wants the reward, but what about the risk? Payers have been shedding risk for years, more than a decade. First, they gradually shifted their book of business from 70 to 80% fully insured to 70 to 80% self-insured, putting all the risk on the employer to pay for care and the hospital to collect larger and larger patient financial responsibility.
Then, payers capitalized on the consumer-directed healthcare trend and dramatically increased the financial risk carried by their members. Your patients, your employees, your family. This little trick dramatically increased the number of medical bankruptcies and even more dramatically increased the amount of bad debt hospitals carry for patients with private insurance.
Now payers are shedding more risk in their new contracts with providers. All the latest trends point to providers taking on more and more risk for the care they provide. They're facing lower payments for fee-for-service care, quality-based payments that may be complex or impossible to manage,
and tiering and restricted networks that will drive up deductible and copayment collection problems even more. Contracts for participating in exchange networks are likely to shift even more risk onto providers. All this has providers asking themselves whether now is the time to start a new health plan, or maybe take full risk for a commercial or Medicare Advantage population.
One thing is clear. The central value proposition that once defined health insurance coverage for needed care, protection from financial catastrophe, and incentives for wellness and preventative care is long gone. Managed care companies, with a very few exceptions, don't manage anything other than their own risk. Hospitals and physicians must now deal with risk as a central capability to be successful.
They also must develop new capabilities for employer engagement, population health management, and wellness. Central to all those, crisp messages, a clear story, and better marketing and PR. That's where ReviveHealth can help.